What is a Medicare Advantage plan? This is the hot topic in today's world. You're hearing about all these $0 plans. You're hearing about all these dental, vision, hearing, food card, getting money back on your Social Security check. You're hearing all these things about these Medicare Advantage plans. What's the truth? What's fake? What's real? You'll get the answers today. So a Medicare Advantage plan, what it does is it actually takes the place of original Medicare. And this may sound like a bad thing, right? But in reality, it really isn't. It's taken the loss, the exposure from original Medicare, the government entity. It's putting it on to an insurance company. Say, I'm not going to mention any carriers, but the big names, the big Medicare companies. It's putting the exposure on them. So now your insurance is actually with that carrier, which means you do have to abide to that carrier's network. So let's say it's company A. If their network isn't only a network with certain doctors, you now have to abide to that network. And if that's okay with you, you've on other health insurance before Medicare, you've probably abided to a network already. So it's no different than normal health insurance. It's just that now this company is taking the place of your Medicare. Again, not a bad thing, just a different thing. Okay, so you do have to abide to their network. So that's one thing about Medicare Advantage. The other thing is now all the co-pays that original Medicare has, now that is put onto your Medicare Advantage plan with, say, carrier A, B, or C. So when you go to the doctor, you might pay potentially a $0 copay, potentially a $5, $10, $15 copay to see your primary care doctor. You could pay, say, $30, $40, $50, or even zero, depending on the area, to see a specialist. Hospitals, there's some areas where hospital stays do not cost anything on a Medicare Advantage plan. That is not most areas. In our area, Missouri, a lot of times it's going to cost $300 a day for the first 5 days, and then the Advantage plan covers everything after. So you do have costs on original Medicare. Those are just going to wrap over to the Advantage plan, and now your costs are associated with that insurance company, company A, B, and C. Not going to mention any carrier names on this video, but now, if you have cancer, you're likely going to pay 20% of the cost. The one nice thing about a Medicare Advantage plan is they do have what's called a maximum out-of-pocket. A lot of people do call this a MOOP, M-O-O-P, maximum out-of-pocket. What this does is this caps your cost, okay? So in our area, in Springfield, Missouri, or a lot of places in Missouri, you're going to see a maximum out-of-pocket between $2,000 and $5,000, depending on the plan, the company. There's a lot of differences between HMO and PPO and what that maximum out of pocket is. I'm just giving you a range. It's really going to depend on which plan you decide to go with. Maybe we can be the ones that help you decide which plan makes sense. But compared to original Medicare, where there's no maximum, you could pay $1 million potentially. I mean, that would be crazy, but you could. A Medicare Advantage plan is going to max you out, at least in Missouri, between $2,000 and $5,000 annually if you were to have something bad happen to you. So there is a stop loss there. Some pros to a Medicare Advantage plan is they do, a lot of times, they do include dental, vision, and hearing coverages. It can be anything from cleanings all the way up to covering dentures and implants. Again, it's going to depend on the plan. They do a lot of times include silver sneakers. They include an over-the-counter benefit. So there's all these add-ins to Medicare Advantage. So if you're a person who is okay with the copays, a Medicare Advantage plan could make sense for you. A lot of times they do come at $0 premium, and sometimes, not in every state, there's very few states that do this, but sometimes you can actually get a reducement, or a reduction I should say, of your Part B premium. So with a Medicare Advantage plan, you do still have to continue to pay your Part B premium, which for most people in 2022 is $170.10 a month. So you do have to continue to pay that, but there's no additional premium to a Medicare Advantage plan, generally speaking, depending on the area. Okay, there could be, there could not be, and sometimes it gets you money back, but that's very rare. So you might see some TV commercials saying, hey, get your money back. In some areas that's true, like say Florida, some areas of Texas, Georgia, California, you can get those plans. The reality is everywhere else it's generally not true, unfortunately. But a Medicare Advantage plan would generally be for someone who's okay with copays, who's okay sticking with a network. Once the extras of the dental, vision, and hearing, silver sneakers, over the counter, all that good stuff, and is okay just having the copays in the network. If you're okay with that, a Medicare Advantage plan could make a lot of sense. If on the other side, you're okay paying extra for not having a network and getting everything covered, a Medicare supplement may be the way to go. But Medicare Advantage, it is getting more and more popular. There's going to be more funding going into them, so they will continue to get better and better, most likely every single year. It just depends on your situation. So again, if you got Medicare supplement over here, you pay a premium for them, but they are great coverage. Don't have to worry about networks, don't have to worry about prior authorizations, referrals, any of that. Then you have Medicare Advantage, which you do abide to a network. You may see prior authorizations. That is a downside, is you could see prior authorizations if you needed a surgery. A lot of times if you're in an HMO plan, not always, but a lot of times if you want to see a specialist in an HMO Medicare Advantage plan, you're going to need a referral to see say a cardiologist, a podiatrist, something like that on the specialist side. Medicare supplement, you're not going to need that. There are some PPO, as in preferred provider organizations, PPO options on the Medicare Advantage side that actually you don't need referrals for. And if you go with a nationwide carrier on the PPO side, a lot of times they'll have nationwide networks. So say if you're in a different state, you don't necessarily have to worry about it too much. Medicare Advantage is pretty intricate. There's a lot of details. There's a lot of benefits and copays. And in every county in the United States, the plans are different. So what we have in Greene County, Missouri, which is Springfield, Missouri, is going to be different than St. Louis, Missouri, or Kansas City, Missouri, or Florida, or Texas, or Alabama. Every plan is going to be different. The carriers are different. The plans are different. The copays are different. And so what I would suggest is you work with an expert in your area, or maybe an expert that knows your state. Like say we're Missouri Medicare Advisors. We are an expert in Springfield, Missouri, and Missouri. We know the plans in and out. We know the networks, the copays. We know what works where. And so if you're looking at Medicare Advantage, I would suggest you talk to an expert. That could be us. It could not be. But Medicare Advantage is one of those things where you're really going to talk to someone who knows what they're doing, been doing it a while, and helped a lot of people. And, it could be a good fit for you. So if you have any questions, you can absolutely call us at 417-633-7200 or go to our website. You'll get a lot of information there, hopefully answer a lot of your questions, which is www.MissouriMedicareAdvisors.com.